So hi, I am Suzanne Taylor. I'm your occupational therapist, and my role as part of your bone marrow treatment team is to help your person be them. And what I mean by that is for them to be able to do the roles and tasks and live their life the way they want to be able to live their life now that they've gone through cancer and they're going through a transplant, and to work through all the side effects. And I want to start by saying thank you for being there to love your person and to help them with this. And we just very much appreciate it. And I want to also be there for you to help you to know how to love your person without enabling them. Because there's a line there between helping them because they're having problems after the transplant and then doing too much to where they don't ever get their independence again. So the two main topics that I want to talk with you today about they're called cancer-related fatigue and then cancer-related cognitive dysfunction. The handouts are part of the patient resource pack, and I'm available on the unit, and my contact information is there as well, so we'll cross paths as well. So cancer-related fatigue is understood that upwards of 80% of the population that has cancer and they've had chemotherapy experience cancer-related fatigue. And about a third of those people will keep this fatigue, this type of fatigue, for months and even years. And there's not tons of research on this topic. We're still at the point in our understanding of cancer and the treatments that we are doing research to better understand what causes it and how to treat it. So the information that I'm giving you comes from our current knowledge, our current research, and then also my experience for working here on the bone marrow transplant program. And the first part is cancer-related fatigue is not like general fatigue. It's not something where you can just take a nap and feel better. It's more of a general being knocked down from your normal energy levels. So if prior to cancer you were able to get up and go and do your whole day, this is less than that. So a lot of times I use an analogy of a car. Before cancer, the person's driving around in a Dodge Charger with a Hemi, and they can go pretty fast, they can go pretty far, they know how good the gas tank is, and there's even an economy mode so they can go a little further and be more fuel efficient. When you first get diagnosed with cancer, it's kind of like being in that same car except somebody switched out the engine. So you look the same and you're doing the same roles, but you can't do it as well. And that's typically where the person notices they're just not feeling right. And then they get a diagnosis of cancer and start treatments. And that's kind of like taking you out of that car altogether. So now you're not in the Dodge Charger, but we're going to put you down a level of a model, maybe into a Toyota Corolla. You're still in a car, you're still running around, you can still get things done, but not like you used to. And then as time goes on and more treatments go on, it's like the car is aging and the fuel is less efficient and the person just can't get as much done. And the hazard is that the person accepts this as their new, this is it. And I want to let you know that it doesn't have to be it. The cancer-related fatigue does not have to stay. There are ways to work through it so that you can get back up to that original car model. Okay? So the variables include changes in the blood level, having pain, not being able to sleep as well, the psychosocial stressors, all of those combine and cause the problem. So one of the first things that I have people understand is it's much better to do a little bit all day long than it is to try to start the day and jump head in, feet in, and do it as though they're in their original car, because it won't work. If you take the Toyota Corolla and you try to drive it like the Dodge Charger with a Hemi, it's not going to work right, and the person won't make it through the whole day. And I often hear people tell me that they are doing okay until right around dinner time, and then they're either too tired to eat or they're able to eat and they go right to bed. So now they've taken their normal who they are and their roles in life, and they've gotten it to the point where all they can do is get up, get through the basics in the day, and then go right back to sleep. And that quality of life is not typically where people want to stay. So instead of jumping in right away and trying to get the day done like before cancer, I want people to get up, get dressed, do a morning routine, rest as they need, do some exercises, eat some lunch, and just kind of spread it out through the whole day. And I do spend time with people to help them take this concept and put it on their own routine and who they are. And the other tips that help with cancer-related fatigue is to stay hydrated. If you're not drinking enough water or if you're not having enough fluids, it's going to cause you to be fatigued. Because even though your person has had cancer, has cancer, is in remission, is going through this treatment, they still have a human body that will still fatigue like anybody who doesn't have cancer. So if you're dehydrated or you haven't been sleeping well or you're not eating well, you're going to have that layer of fatigue on top of cancer-related fatigue. So we have to make sure that those types of variables are taken care of. And also sleeping well. So in your packet of information, there's a sheet on there that's called Good Sleep Hygiene, and it's the tips that come from the National Institute of Health and one of our other centers for good sleep on how to take different pieces of different concepts to put them together so you can maximize your sleep. Because obviously if you're not sleeping well at night, you're going to be more tired during the day. And again, we already have cancer-related fatigue and the treatment-related fatigue. We don't need to add in poor sleep, so I'm fatigued, or not eating well, so I'm fatigued, or not staying hydrated, so I'm fatigued. So the sheet that is in there for the good sleep gives that, along with resources on how to look further into that topic, as well as the tips for cancer and treatment-related fatigue. And now shifting gears onto the other topic for cancer-related cognitive dysfunction. This used to be referred to as chemo brain. And as recent as 5, 6, 7 years ago, the literature was still divided, and many researchers were still saying that there was no such thing as a change in cognition associated with cancer or with treatments. And from working with patients and families, I really was sure that this is a thing. And now research supports it, and they do acknowledge that cancer-related cognitive dysfunction is real. It's not because the person had problems before they had cancer, and it's not because the person's being lazy or anything else. It is purely the changes that happen from having cancer and from having chemotherapy and radiation that cause the brain to not be as efficient. So the brain's ability to take information in and manipulate that information and then use that information is very often changed. The current statistics show that 75% of people with cancer, any cancer, all of the cancers put together, 75% of the people are experiencing changes in their cognition. And of those 75%, about a third of those people will have those changes for months to years. So it is real, and it impacts the person's quality of life. The areas that you will notice it is attention, memory, the short-term memory, and also with numbers. Those are the 3 areas that when I test people, those are the areas that cause trouble. So what that means in everyday life is I don't want the person who's undergoing these treatments to be in charge of their medication or the household finances, because those are 2 very important areas that you can't afford to have mistakes. And being the caregiver, helping do those pieces and overseeing the medication. I mean, it's especially difficult when you're through the transplant and you're coming to clinic and you have a pill box that's set up, and then you come to clinic and they make a change in the medicine. So if the person themselves were managing the medicine, they have to remember that there's a change. Then they have to go home and take out the pills or change the pill box to match what the change in the medication is. And it's cumbersome at best. So I strongly recommend that the person going through these treatments is not in charge of their medication and they're not doing the finances, because the tendency to transpose numbers or to do errors in math is very common. And like I said, it has nothing to do with levels of intelligence or what the person was doing before all of this. I've worked with attorneys, physicians, mortgage bankers, all kinds of different people that use their brain as their job, as their career, who come in and we do testing and they have difficulty with some of these simple tests. And it's nothing more than the fact that their brain's ability to follow the pathways has been hindered by both the cancer and the treatments. So what I work on with people are cognitive exercises. So just like the physical exercises and the physical activity for cancer-related fatigue, I work with people to do the cognitive exercises so that they are challenging their brain to think, to remember, to process, to manipulate information in the head and bring it back out. And I give people homework. So you'll hear other patients and caregivers, and you'll hear people talking about it in the clinic, about their homework that they have to do or their thinking exercises. And this is because, again, like I mentioned at the beginning, my job, my role, and my passion is to help people be who they are, even though they have these side effects, to help people work through these side effects. So the information is not to scare you or to say that this absolutely will happen, but more than likely it will happen. Don't be alarmed by your person being very fatigued or seeming like they're having senior moments or problems remembering things they used to remember. It's common, and we can work through it, and I'll help you help them, and we'll make sure that we're setting them back on a pathway to becoming who they are. And again, thank you very much for loving your person and for being there for them. My contact information is there in the research or in the resource finder, as well as on the handouts that go with it. And please feel free to stop me whenever and ask questions, because I'm there for you and your person.